Well, welcome back for another edition of today's Healthline 3. Joining us today is a brand new physician to the Healthline 3 family. We are talking with Dr. Karen Lillick-Birkin with Willis-Knighton Health System. So welcome aboard, Dr. Karen. I am so excited to have you here. And we are talking all things women's health. So if you guys are watching us online right now, remember that you can submit your questions online on the right-hand side of your screen, or you can give a call and chat with Dr. Karen directly. Ask her anything that you want. Do you prefer Dr. Birkin, Karen, Dr. Karen?
Either one. It doesn't matter.
All right. Well, welcome aboard. Tell us a little bit about yourself.
I'm born and raised in New Orleans. Grew up there, then left for a little while for college. Went up north to Notre Dame, and then decided to come back home to Louisiana. Started medical school here at LSU, and then I've really been here basically ever since. There was a short 1-year gap where I was in Houston, but did all of my training here, and then joined the group at Willis-Knighton Bossier.
All right, so when we talk about your training, you are very well trained, very skilled, and from what I learned, you concentrate on high-risk obstetrics, is that correct? And also robotics. Tell us a little bit about your specialty.
With obstetrics, there's very low risk patients, very healthy patients, and then there's patients that have all sorts of things going on with their pregnancy and outside of pregnancy that we have to kind of manage, not only with the mom but also with the baby. And so just through my training at LSU, we kind of dealt with a lot of high risk situations, and so became fairly familiar with that and comfortable with taking care of higher risk patients.
I hear that Shreveport is definitely a good place to learn because you see so many different types of cases. Do you feel like you're...
It definitely is, and that's the way you want your training to be.
Yeah.
You want to see it while you're learning, not while you're out, practicing on your own 2 feet.
Like, wait, what is this? I haven't seen this before.
And so LSU here provided some fantastic training with lots of high-risk situations, and I felt very prepared, moving forward from there.
The robotics training as well, for me, is a big deal because it's very rare that you can find a surgeon who is trained in that area, because one, you learn with your hands, but now you're learning to do it through a robot. Can you tell us a little bit about some of the minimally invasive, I think, surgeries that you conduct?
The most common one is a hysterectomy. There's many different ways to do a hysterectomy, and we try to cater the surgery to the patient best we can, but minimally invasive is ideal, basically to provide small incisions, as small as possible, and that helps with recovery and overall the surgical experience that the patient has.
Excellent. Is there anything that you see most common here? Is there an area of conversation that you really want to touch on?
As far as GYN goes, we deal a lot with patients that are just having abnormal bleeding at all different ages as well. Patients that are really young, just starting their period, all the way up to postmenopausal age that are starting to have bleeding again when they're not technically supposed to.
Very interesting. You touch on a subject, and I'm going to get a little vulnerable here. I'm 38 years old, and I've even seen some major changes, and it becomes scary because you're wondering, what's going on with my body? Is 35, 38 kind of that turning point in a woman's life?
There a lot of people, talk about, your 40s is the new 30s and everything, but there are certainly hormone changes that start to happen. Typically cycles are a little bit irregular right when they start,
right,
and then they can become irregular again due to various factors as people age just a little bit and get closer to menopause.
So you might be using all the right creams to hide the wrinkles, but the body is still in the same stage.
Exactly, and there can be lots of different reasons, and so that's definitely a conversation to have, with your doctor and with an OBGYN to kind of figure out what the issue is.
All right, so let's talk a little bit about women's health. When you're going in to get that regular annual checkup, first of all, how many times should you be going a year, and what questions should women really be asking?
So typically just for your annual checkup, it's called an annual for a reason. It's recommended
just need one a year.
Just to come once a year to talk about all aspects of female health, not only pap smears, but issues with depression and cycle health and just overall screening, and are you staying up to date with mammograms and things like that.
So when it comes to mammograms, what do you recommend? Because first we were hearing you shouldn't do it too young, too early. You don't want to expose your breasts to the radiation. But now we're hearing maybe you should get it earlier. And even I have questions. I'm 38. I'm not sure. My mother is a breast cancer survivor, and I've never gotten one done before.
Yeah. So, and the difference with the change in the recommendations, as kind of all of that happens in medicine, recommendations change, new studies come out. The amount of radiation from a mammogram is so minimal that it's not considered harmful anymore to have one. Now, the age cutoff is more because mammograms are done differently than via x-ray than, let's say, an ultrasound.
Okay.
And so different densities of tissue you can see better on mammogram versus an ultrasound.
All right, well, with that, we're going to take our very first caller, and I believe Carol is on the line to ask Dr. Birkin whatever question she wants. Good morning or good afternoon to you, Carol.
Dr. Birkin, this is good afternoon to you too. I have to hurry with this question because another call is coming in, but I have a very like a real strong urine smell in my when I urinate, and what I get upset about is it's all the time, and I don't have sex because I'm a widow and I choose not to get remarried or having a relationship. I don't know what to do about it. Even they just send me stuff for a vaginal infection. But what do you do? And I had my ovary removed in '88, one of my ovaries, because I had a cyst on it. So what do I do?
I heard the second half of that question.
So I think she's asking, if I heard you correctly, Carol, you're having some changes in the scent or the smell of your urine, and you want to know what it could possibly be the cause of this. You haven't made changes in your diet, from what I heard you say, and you also had, it sounds like her ovaries removed or a hysterectomy. Is that accurate?
I just had a partial hysterectomy, one ovary removed because of cyst.
So what is it that could potentially be causing the change in the smell of the urine, and what could she do about it?
It's just strong all the time. I can't get rid of the smell.
So, certainly those changes can be because of a variety of factors. The most important thing to rule out in that case would be to make sure there was no infection. Urinary tract infections or UTIs are incredibly common, and certainly a change in the smell or the scent of urine can be associated with that, and an early warning sign that there may be an infection there.
So, Carol, do you have a physician currently or a GYN?
I live in Minden, or close to Minden, and I don't want to go to David Raines.
Okay.
Is there a OBGYN in Minden?
Well, she's with the Willis Knighton Health Systems. Carol is.
Right.
I'm not sure about what there is in Minden, but if you want to get in touch with Carol or try to maybe make an appointment with her office or give a call up there, do you know the information or the number or the email?
So we're located at the Willis Knighton Bossier main campus. So it's in the main hospital building, but just kind of off to the side. It's Suite 240. It's on the second floor, and the main phone number to call to get in touch with us is going to be 318-212-7931.
All right, Carol, were you able to get that?
Yeah, I want to see if I can look at Minden, because see, I'm totally blind, and I have to get someone to
drive you out.
Get the bus to Minden.
Mm-hmm. Oh my goodness!
Thank you
Carol.
for your information.
Oh, you're welcome. Thanks for calling.
Yes, please, Carol, try to get some assistance as best. I love it when people call in, and I want to try and help as much as possible. Carol, also take down my email address. We'll see if we can do something more for you. Do you have a paper and pen?
No, I don't.
Oh, okay. Well, you can find me online, Carol. If you want to send me a message, you can certainly go ahead, and we'll see if we can just try to help you, especially since your situation is very unique. Thank you for calling us in.
All right, thank you.
So changes like that they can happen at any age, a UTI.
Absolutely.
And that's something that women can avoid. What are some of the signs that or things that they can do to prevent?
So just, general vaginal health and hygiene and cleanliness is a key component of that. Certainly if you have any warning signs, like Carol kind of explained, change in smell of urine, blood in the urine, urinary frequency. So you just feel like you're going to the bathroom more frequently than you're used to, or urgency. You have that sudden, urge to go a lot more frequently, and pain, even pain when on urination. All of those can be alarming signs that you need to, go see a healthcare provider, go see your OBGYN.
I think something that a lot of women overlook, and this may have been something that I went through and I started to realize and learn a little bit more about it, but we are always on the go. Mm-hmm. And so we tend to not urinate completely or really take the time. Why is it important to make sure that everything is happening the way it's supposed to, and that you're not, stopping it or cutting things short? Because that, I think, can lead to an infection. Is that accurate?
Well, and certainly, holding your urine for a prolonged period of time, or
doing
or
that like on the set of a newscast.
Patients that are not able to empty their bladder, as readily, those can definitely be setups for early infections, and you just need to kind of stay vigilant and listen to your body. And if you feel like you need to go to the restroom, then try to find a way to get there.
And make sure that everything comes out. You're not trying to just get up and go and run and take care of the babies or the kids or whatnot. Anything else when it comes to women's health and the mammograms? Oh, even bone scanning. Is that something that was a big concern?
That's another thing. Osteoporosis and osteopenia, which is basically low bone mass at a kind of a lesser extent than osteoporosis, is a huge problem. It plagues kind of the older generation just because of menopausal changes, loss of estrogen, and you start to lose that bone mass. You have peak bone mass when you're young and healthy, and you don't notice issues until much later in life when it's too late to kind of correct the problem, and fractures are a big issue, hip fractures in particular.
So is it more of the earlier you can detect it, the better that you need to go in and see a physician, or are there things that people can do at home to make sure that their bone density or bone mass is staying where it should be or in a good level?
So it's at a younger age, certainly a healthy diet, taking your vitamins, particularly your calcium, your vitamin D, and then maintaining some level of weight-bearing exercise is really all you can do, because genetic factors you cannot change.
Okay.
Avoiding smoking is another big one that is helpful. When you're older, if you have any risk factors, then certainly you can get scanned earlier, or if anyone that is a normal person that has no risk factors whatsoever at age 65 definitely needs to start getting screened.
So at 65, make sure that you are questioning your physician and saying, look, I need to get these things, if they don't already bring it up in their screening.
Correct.
All right. And as for the mammograms, we didn't say what would be a good age to start doing those detections.
So typically at age 40 is the standard. You have a mammogram every year. And it's just a screening mammogram. So mammograms are screening if there is no problem, or they're a diagnostic mammogram if you're actually experiencing an issue.
Okay.
So the type of test that's done is a little bit different if it's a screening test versus a problem visit.
So if you want to do one at home in the shower, is there any recommendation on how to do one, or to give one for yourself at least, just to check up?
So, and the typical kind of self-breast exam was taught for a very long time, and that's.
Or do we not recommend that anymore?
They've kind of changed the language a little bit to breast self-awareness. So you don't necessarily have to put on your calendar and make sure you're checking every single month in the shower, but just being aware of what your body naturally feels like, and if that changes at any point, to let your doctor know.
Okay, so it's important to just be self-aware, like you said, knowing who you are, what your body is typically used to, and the changes that you do begin to see. Very important and good, useful information.
Yeah.
All right, when it comes to having babies, you have 2 of them yourself. What are some of the things that you want women right now to start looking out for?
So basically your health during your pregnancy starts before you're ever even pregnant. Honestly, your vitamin status, your overall health, exercise, making sure all of your medical conditions are as controlled as possible before you become pregnant. And then that transitions into hopefully a very healthy, controlled pregnancy as well.
What about for women who are reaching kind of the latter end of their 30s, early 40s? They haven't had children just yet. There is still hope out there. What are some of the things that they can start doing maybe to prepare their bodies so that it's not such a hard, arduous process or expensive
Absolutely,
process?
Yeah, and we're seeing more and more moms at older ages just
Right.
because women are
Doing
busy.
more with
We're in
their
we're in the
careers.
workforce and we're having to delay childbearing, and so really just having that conversation with your doctor and telling them that you're thinking about conceiving, and so you can optimize your cycle and you can really maximize your chances of getting pregnant. And if there is an issue, we can address it sooner than we would necessarily do for a younger patient. We try to address infertility within the first 6 months instead of waiting a full year.
Is that a way of actually testing it and checking the body when you say infertility?
So basically, if someone is trying to become pregnant and they seem to be having an issue, the first step is to come in and to come see an OBGYN and to come see us and to really have us go through everything about you and try to pinpoint what the main issue is, because there's a whole slew of problems. And so if we can pinpoint the problem and correct it and do that quickly, we like to do that, especially in the older population, so that you're not trying for no reason.
Right. So you have a little bit more of a focused goal.
Right,
And you know
exactly.
which avenue then you need to start taking.
Yeah.
Anything that you recommend, because now we're starting to see, if you go into Whole Foods, there's collagen, there is this, there is that, there's all these things that you can take. You see all of the YouTubers and the social media influencers who are telling women to take all of these different supplements. Are they necessary?
So it depends. There are some fantastic supplements out there. The difference between prescriptions and herbal supplements is just how regulated they are and how much you can guarantee what you're taking is actually what you think you're taking.
Okay, so collagen, when we were talking about bone density, does that really help? Or
the studies on that are still out
Okay.
for debate.
okay,
You
so
know,
that $50 bottle of collagen that I've got at home may or may not really be doing anything.
I don't necessarily think it hurts anything,
Okay.
but we don't necessarily know if it helps yet.
Maybe it's just giving me a placebo effect of thinking that everything is
Right.
doing well. All right, let's talk a little bit about the, what did we call it? Contraceptives, birth control, going back to the birthing. There's so many options out there right now. What is it that you want to recommend for women?
So it depends on the patient. I kind of like to separate birth control into hormonal and non-hormonal methods, because some people can't have hormones or don't want hormones.
Okay.
And then there's also short-acting and long-acting. So people that think that they just can't take a pill every day and they won't be reliable at taking their birth control, then that's not going to be a good birth control for them. And so there's some longer acting ones that kind of like to say you can set it and forget it, and not have to worry about scheduling a time of day to take a pill every single day.
Are there any fears that are associated with some of the longer term contraceptives?
There are, of course, if you Google anything, you'll
Right.
find horror stories about just about anything.
On WebMD.
But a lot of the longer acting birth controls are implantable birth controls.
Okay.
There's one that goes in the arm and also several that go in the uterus. And so some people can really wrap their head around that idea, and some people just cannot.
Right.
And so, I try to counsel patients and really kind of express the advantages of doing birth controls that are longer acting, try to get them past the thought of just having something there.
All right. And let's go back to a little bit about your training. Again, you do non-invasive surgeries, and just tell us a little bit about what that entails.
So as far as minimally invasive surgery, there's various routes of doing, for example, a hysterectomy. So you can do a vaginal hysterectomy, which is having no incisions on the abdomen whatsoever. You basically remove the uterus and the cervix, like you would deliver a baby, essentially.
Okay.
And then as far as other minimally invasive types, there's laparoscopic, and then there's laparoscopic with the assistance of a robot. And the main difference between those two is, while a human can only turn their wrist so far, a robot can turn it exactly 360 degrees. And so if I'm controlling a robot that has more dexterity than I have myself,
Right.
I can do finer dissection, finer surgery, and get a better outcome for the patient.
Absolutely, and it's less inflammation for the body. You're not going through the top down, you're from the inside
Right.
working. It's so amazing to me still, the process and how that works. How long did it take you to learn that?
So it was a gradual process. I learned it in residency. I came out of residency having my certification for training, but it takes a couple years to feel pretty proficient and solid with it. So.
All right, and I love the fact that you are kind of freshly out of college, freshly out of residency.
I was about to say college is a little
yeah,
further.
not college, but residency and doing your training, because to me, those doctors that are young, they have all the latest information, all the latest knowledge. You have been keeping abreast with what is going on, whereas physicians who are older obviously have the experience that we don't have yet in the younger years, but you certainly have all the new information. I mean, do you see that and do you feel that when you're working with your patients?
Yeah, absolutely. I mean, things change so quickly in medicine.
Right.
There are things that my older partners have seen and have done that definitely help me out, because they're the tried and true method, and,
Right.
and they've had the experience behind them. And then there are brand new things that come out every day in medicine, and so having trained recently definitely keeps me aware of what's coming down the pipeline, and trying to keep up to date as much as possible.
All right, well, we have about 10 minutes left. What is it that you want to talk about? Is there anything that you want to touch on that we haven't already addressed?
So
You know all the details. I'm just going off of what I know as a woman and what I can think of that would affect me.
yeah, so I mean, I know we touched on birth control a little bit, and touched on pregnancy a little bit as well. I would kind of like to talk about the HPV vaccine.
Absolutely, yes.
I know that's kind of a hot topic right now as well.
Yes, and there's so much information out there. One minute I'm hearing, you can't get it at an older age, and then I hear something different. So please debunk any of the myths that people have.
The vaccine traditionally was approved just for younger age 9 up to age 26. What you're referring to is that they've recently upped the age all the way up to age 45, mainly because people are becoming re-exposed and exposed to the HPV virus at older ages now, and we're seeing a lot of benefit from the vaccine in that slightly older population.
So can you take the vaccine if you have already been sexually active?
You can.
Okay.
You can. There are, just like with the flu virus, there are lots of different strains of the human papillomavirus out there, and the vaccine protects against the 9 most severe strains of that virus. But you could have become sexually active and been exposed to one of them, but not all 9, and so the vaccine does still provide you some protection.
And for some people who have misconceptions out there, or they think, well, I've been sexually active, but haven't seen anything, haven't seen the signs of anything. That doesn't mean that it's not in your body. Is that correct? That the virus isn't there?
Right. Yeah. And HPV is a classic example of that.
Where it lays dormant.
Right. It can kind of be dormant, and even if it's not dormant, the changes happen so slowly, sometimes over 5 to 10 years, that you can have no symptoms at all until you come in and have a pap smear, and that's the purpose of the screening test, is to detect these abnormalities early before they actually become an issue.
And when you are doing that screening, what is it that you're looking for? An abnormality in cells?
So we're looking for abnormal cells of the cervix, or if someone doesn't have a cervix, we can do a vaginal pap smear as well. But mainly abnormal cells of the cervix, and also we can detect for those HPV virus strains.
For those people who don't maybe realize, even if they're younger and they're not sexually active just yet, or those people who are sexually active, why is it that you really want to guard yourself against HPV? Some people don't they figure, I can't really see it. I don't, it's not affecting me, so why care?
Right. And it is just such a common virus. About 90% of women will be exposed at some point in their lifetime. And so when you think about other vaccines that we get where the exposure rates are much lower, and you get that vaccine without any question, and then there's something as common as HPV, and a lot of people aren't vaccinated, and it's something that can really sneak up on people.
Is it true that men can carry it? They don't show the signs, however, and they are the ones who pass it on.
So both men and women can carry it and not necessarily show any signs and pass it along. We are actually seeing a lot of problems arise in the male population as well, though.
Wow.
You can see penile cancers and anal cancers and all sorts of things that come about.
So HPV can actually lead to cancer, or they are cancer cells, right?
The HPV virus itself can then cause changes to the cells that would progress over a long period of time to actually precancerous and then cancerous cells.
See, I'm learning this too as you're talking to me. It's very interesting because what we normally think of as a virus like coronavirus, you don't think of it actually turning into something that could change or alter the shape of the cells or create abnormal cell growth, which is cancer.
Right.
So this is something that people need to be looking out for and asking their physician about, or should their physician already be offering that typically during their physical exam?
Typically that is offered to all patients. Certainly if your physician isn't, then ask them about it. Maybe they don't do pap smears, but they could refer you to someone that does.
All right. We have just a few more minutes left. I'm loving this conversation. Tell me a little bit more maybe that you haven't had the chance to really touch on. We talked a lot about STDs, HPV, getting that vaccine. When it comes to coronavirus, we know that is obviously still a hot topic. We've got various strains. Why is it still good for women to not avoid getting their checkups if they're afraid right now to go into a doctor's office?
So, in all doctor's offices, ours as well, we do take a lot of precautions to try to prevent the spread of coronavirus. We're all masked at all times. We
have to protect yourselves. Yeah.
Right. We limit the number of people in the waiting room. We have rearranged appointments to limit the number of people coming in and out. But it's been around for a while now, and there's certain things that you eventually just can't put off anymore. And so with the proper precautions, it is safe to go in and come see your doctor.
I would assume, since you guys were on that top tier list of vaccines, that you've already maybe gotten the vaccine?
I have. I've completed both of my doses, I believe, back in January.
Do you feel like it's safe?
I do feel like it's safe. I know there are side effects associated with it, and those side effects are typically just signs of the vaccine actually working and kind of ramping up your immune system. I personally had very minimal side effects. My arm was slightly sore, and that was about it. So I was, I guess, one of the lucky ones. Yeah.
Well, that's good to know. Obviously, we want to make sure that everybody is staying safe and that they feel good going in. And we don't want women avoiding those pap smears right now because, like you said, it can lead to cancerous cells and a host of a lot of other issues. Are you finding that at all in your office, that some women have been a little hesitant?
Yeah, we are seeing that patients have kind of delayed coming in, even because we weren't doing screening tests, back last year when coronavirus first hit. There is a backup of scheduling sometimes with mammograms and whatnot, but we're starting to kind of catch back up now and seeing that people are coming back in. But there are people that have been at home and just have tried to deal with issues that have been bothering them for a while, that have been wanting to come in for a very long time and have been delaying because of coronavirus. And I just encourage everyone to go ahead and come in and get checked out.
All right, excellent. And Dr. Karen, tell us once again where the public can find you.
So I'm at Willis-Knighton Bossier in the main hospital. It's the Women's Health Associates group, and you can come see me. Just give us a call. The number is 318-212-7931.
All right, excellent. Thank you so much for joining us today and for answering all of those questions. We're so excited to have you here, and hopefully you'll come back and chat with the public a little bit more about getting those annual exams, your mammograms, and any other gram
Yeah.
or exam. All right, thank you again, Dr. Karen. And anything else you want to say?
No, I think that's it.
All
Thank
right,
y'all.
everybody have a blessed and wonderful day. Thank you so much for calling in and chiming in and watching. We'll see you guys back here next month.